Good afternoon. Thank you for being here. Today I'm excited to share a new asthma intervention called Take a Breather, a community-based program created to support Black young adults aged 15 to 25 who are living in the Bronx. This program is rooted in community engagement, health equity, and long-term sustainability. We'll walk through the needs it addresses and how it works, and how we plan to evaluate the impact. Asthma is a chronic disease that affects over 26 million people in the United States, but its impact isn't felt equally. Black and Hispanic populations suffer disproportionately, with asthma rates 3 times higher than the white population. In the Bronx specifically, poor air quality, public housing conditions, and limited access to health care create a perfect storm for asthma-related hospitalizations and even deaths. These issues are especially dangerous for young adults who often age out of the pediatric care without proper support. To address this crisis, we designed an 8-week asthma education and support program called Take a Breather. It's based on the proven Yes We Can model, but adapted for the Bronx and young adults. This program includes weekly workshops, home visits by trained community health workers, HEPA filter distribution, and action plan development for asthma. The core idea is to give participants the tools and knowledge they need to manage their asthma day to day, and not just during emergencies. Our approach is guided by the ecological model of health behavior, which recognizes that health outcomes are influenced by many layers, not just the individual choices. At the individual level, we promote self-care and medication use. At the interpersonal level, we include family and peers in the action plans. Community-level work addresses housing issues like mold and pests. Organizational partners like clinics and schools help to deliver services. And finally, policy advocacy pushes for systematic change like cleaner air and more funding to the Bronx clinics. We strongly believe this program must be shaped by the people it serves. From day one, we built a community advisory board made up of Bronx residents, educators, and health providers. We also ran focus groups with young adults, school nurses, and local clinical staff. Based on their feedback, we tailored our materials using local language, relevant visuals, and real-world examples. We also prioritized hiring community health workers who live in the Bronx and understand its challenges firsthand. We designed our goals and objectives using the SMART framework. Our first goal is to improve quality of health. One objective is that 80% of the participants will score at least 75% on the post-program asthma knowledge quiz. The second goal is to reduce the financial burden of asthma by decreasing hospitalizations and improving care over time. Finally, we want to build long-term connections between young adults and community services. We'll measure these through surveys and follow up with data. Evaluating the program is essential to know if it's working. We'll collect data before the program, immediately after, and again at 3 and 6 months. Our methods include surveys, app-based symptom tracking, and interviews. We'll look at how many participants reduced their ER visits, how their medication use changed, and whether they developed a regular asthma care plan. We'll also compare the outcomes with the community members who didn't participate to see if the program made a measurable difference. For the budget, our total budget is $300,000 over the course of 3 years. That equals to about $100,000 per year. Most of that goes to staff, a program coordinator, health educator, and community outreach worker. We've budgeted for supplies like HEPA filters, technology, and printed materials. There's also funding for traveling, consultants, and overhead. This budget allows us to scale steadily while keeping the program community-based and effective. So for the logic model, here's a quick look at the logic model guiding our work. It starts with our inputs like staff, funding, and partnerships. These support core activities such as workshops, home visits. That leads to measurable outputs like how many people attend or receive care. The short and medium term outcomes include fewer ER visits and more consistent care. Our long-term goal is better quality of life and more equitable health landscape in the Bronx. This structure helps us to stay focused and evaluate impact at every level. So in conclusion, Take a Breather is more than an asthma education program. It's a way to address deep-rooted health disparities in one of New York's most impacted boroughs. It gives young adults the tools they need to live a healthier lives and create systems of support that can outlast the program itself. We hope this becomes a model for how public health can collaborate with communities to create lasting change. Everyone deserves to breathe easy, and this is one step towards that goal. Thank you.